I would like to start building on the thesis that I put forward today in the morning, namely that we are facing three big challenges for disability inclusion in the health sector. The first one is how persons with disabilities can benefit from universal health coverage, how persons with disabilities can be better protected from health emergencies, and how persons with disabilities can enjoy better health. And the thesis was that even if we know exactly what to do, as we have been hearing, and we have been knowing it for the last 10 years, even if we have the political commitment at the highest levels, still things do not happen. And I said today in the morning, and this is because two fundamental barriers actually. The first one is the lack of evidence-based technical guidance. And most importantly, and the one that I would like to elaborate on now, is disability inclusion is not a political priority in health. And actually, I would like to say, and to add something to this statement, not yet, but we will get there. And in order to get there, I thought it is important to analyze where we are or the why we are not there yet. And in order to analyze that, it's also helpful to look at frameworks that can help us to see how to move forward and how we get there. And there is a well-known framework on health policy that is very well presented in two publications that dedicate itself to how to make topics political priorities in health and what are the fundamental components of that. And the authors of these publications bring it and narrow it down to 4 different factors that need to be taken into consideration if one wants a specific topic to become a political priority. And in this case, again, to emphasize, is we want to make disability inclusion a political priority in health, in the health sector. So these are the fundamental factors that we need to take into consideration. First of all, the topic characteristics. Secondly, the political context in which we are. Thirdly, the ideas. And fourthly, the act of power. Let me go briefly to each one of those. In terms of political characteristics, what it is meant, it is really the features of the topic. In terms of disability inclusion, first, what is the relevance of the topics? Do we have credible indicators to assess that we are making progress? And do we know what are the effective actions to move there? And I would say that if I would have to grade or the rate where we are from being nowhere at all to being exactly there where we need to be in order to move forward from 0 to 10, I would say, you know, in terms of the relevance of the topic, I would say no doubt. It is a relevant topic. We have the policy frameworks, as we have been constantly hearing, that it is a fundamental topic to move forward with the Global Development Goals. No doubt we could, however, we don't have yet those credible indicators that will help us to move forward and to say that we are making progress. And also in terms of effective actions, there is still some work to do. So, and again, it is because we need to move from advocacy to action through evidence-based guidelines. So that guidance, for that reason, I would say, look, and for the sake of exercise, let's say we are at 6. We should be at much higher, but we are at 6. In terms of the political context is, do we have, or the question that we need to answer, do we have policy windows and windows of opportunities that allow us to advance in this area, to make really disability inclusion a political priority? And of course we have those. We have been hearing them throughout the morning. Is the Sustainable Development Agenda. We have the Goal 3 that talks about ensuring healthy lives and promote well-being for all and all ages, of course, including persons with disabilities. And a framework that we will continue using to move forward this agenda. And I would like also to mention, we have today something that I personally think, and from a WHO perspective think, will fundamentally change the UN system, and it is the Disability Inclusion Strategy launched by the UN Secretary General in 2019, that is also asking for disability inclusion in all programmatic areas. And I already seen how this disability inclusion strategy is changing the way, excuse me, how all the programmatic areas across WHO are starting or they are thinking about disability inclusion. So a fundamental framework that is a tremendous window of opportunity. And last but not least, even if it is difficult to mention these disastrous situations that we are living, or this very challenging situation that we are living of COVID-19 as an opportunity, we need to also realize that we can convert it in an opportunity, because we have seen that persons with disabilities, as it was said today in the morning, are one of the most affected population of the pandemic. So we can also use COVID-19 as an agenda to leverage disability inclusion in the health sector. And for all what I have said, I would say, probably in the political context, we are very well positioned to move, and the political windows to move with disability inclusion as a priority in the health sector. So let's really say we are already at 9. Now let's reflect on the ideas and what is meant with the ideas. Ideas refer to the cohesion in the way in which those involved with the topic portrayed. And those involved with the topic is, of course, all the disability community, all disabled persons organization, and all those working the field of disability. But in this case, if we are also talking about disability inclusion in the health sector, we are talking about those involved in the health sector. And here I have to say, I think we still have a lot of work to do, because when we talk, or when we refer to disability inclusion in the health sector, we still need to create a common narrative on how to move this agenda forward between the disability sector and in common with the health sector. And to put an example, we still cannot really, or have not clear idea on how we should name this area of work. Sometimes we talk, as we are talking today, of disability inclusion in the health sector. Sometimes we talk about inclusive health. Sometimes we talk about other terminologies. And but however, we do not have a common narrative that unified, again, that is consistent in both sectors, in the disability sector and in the health sector. And now let me go to, therefore, again, and to challenge also all of us a little bit, I would say, in terms of ideas, again, we need to really do a lot of work. So I would even dare to give us a tool. In terms of actor power, and here we are referring to what is the stakeholders cohesion with a strong leadership to move this agenda forward, to move the agenda of disability inclusion in the health sector. I would say we have a very strong leadership that has been working very well over the last years in the disability sector. We have a strong leadership with WHO and also with different actors in the health sector. However, we still need to come together with a common leadership. Therefore, I would say, let's be also conservative here and say, even if we are now creating partnerships, then I would say a 6 is where we are.
Okay.
And in the light of that,
could you come to the end?
I will come to the end.
Okay.
Is what needs to be done is we need evidence-based technical guidance. We need to build a cohesive narrative around disability inclusion in the health sector, and we need to mobilize actors in the health sector, in ministries of health, also to advocate for disability inclusion in the health sector and not only in the disability area. And this can happen in partnership. It needs to happen now, and I thank you for your attention.